Welcome to the Business Trendsetter podcast, where we talk about trends and how to grow your business. My name is Manny Turan.
And I'm Adam Hartung.
We're here today to help you to grow your business by understanding trends and how to use them. And, one of the things we talk about a lot is this concept of scenario planning. And so trends are never singular. I mean, we talk about mobility, talk about asynchronous life, or the environment or demographics or whatever, but they all act in a blended fashion. And so, it's important to look at holistically the whole package. Individual trends are important, but you've got to look at it in the context of the entire thing. And I know, Adam, that we have some interesting data to share about some of these trends and about how we can learn how to use them together to do scenario planning so that we can grow our businesses.
Well, that's true. And I think that what happens is too many people are so busy managing the business they have today that they don't really think about how it will have to change in order to be successful in the future. So let's start with one trend that we've talked about a lot, and that's demographics. And some people might say that I sort of beat that horse an awful lot. But the reality is we haven't talked about demographics enough, because I still, when I'm out in the world and I talk with people, very few folks bring it up. Very few folks talk about how this is going to impact their business and what they're going to do going forward. The United Nations just issued a report last week on, it's a global report on aging and what some of the impacts of what aging will do to the population of the world and different impacts it will have. About 150-page 150-page PDF document.
Wow.
By the way, available to anyone who wants it. It's a downloadable document. And if people just send me an email, I'll be glad to send them the link. Okay? But let me start off with the demographics, and we'll start talking about what some of the implications are for these things. So in 2021, the world population over the age of 65 is 761 million. Okay, so it's sort of, twice the size of the United States. Okay, that would be the world population. By 2050, that will double. It will be 1.6 billion. So if we're having a little trouble dealing with our retirees today, like I said, by 2050, which is not even 30 years away, it's going to be 1.6 billion. Now, here's the number, though, that's really got me. Those over the age of 80, that today it's 155 million. But because healthcare has gotten so much better, by 2050, that number will be 460 million.
Wow.
So 460 million people over the age of 80. That number is going to triple. It's going to start becoming really common for people to live to be 100. I don't know if you remember, but Good Morning America, if you wound the clock back 30 years ago, they had a guy who did the weather, and his biggest claim to fame was he'd been the original Ronald McDonald. And I don't know why, but he left that role. He ended up being the weatherman on Good Morning America. And he started a thing where he would have the pictures, and he would say, "Happy birthday to anybody who turned 100. And, he'd get one every couple or 3 weeks, and
right.
He'd say, "Oh, happy birthday." Now, they got to where there were so many, there was more than one every single day. And so the Good Morning America had to abandon the program.
Wow.
His successors started doing the same thing. We're just living a really, really long time. And so it's not just a matter of people thinking they can, like 65 being old. It is a truism that the idea that you would retire at 65 is really going to fade very, very quickly. There's too many people over the age of 65 that if we don't have people working and supporting each other, then the economy will fall apart. Now, let me give you a couple more statistics related to this. The percentage of people that are over the age of 65. If you go down most countries today, okay, you get numbers that are in the teens, right? And the top 10 countries that have the most people over 65 are like Japan and Italy and Spain. And it's in the low 20s, 21, 22% of the population, 1 in 5.
Okay.
But because people are living longer and because we had the baby bust, by 2050, listen to this. And Hong Kong will be the most aged country. Hong Kong, which of course will be part of China, 40%. 40%. Almost 1 in 2 people in Hong Kong will be
over 65?
Yes, over 65. In South Korea, it'll be 40%. Okay. When you get to Japan, 37.5%. In Italy, 37%. Spain, 37%. In Taiwan, it'll be 35%. Greece would be 35%, and Portugal is 34%. Those are the 10 most aged countries in the year 2050. But we're talking 1 in 3 people are going to be over the age of 65. So just kind of think about what that would be like if you think about going to the restaurants, going to the park. Think about people buying things like movies. We target movies. Think about the Marvel movies that came out and how much money those Marvel movies have made. Forever, entertainment has been geared to young people, and the old people can just sort of get along with it. But if you get to the point that 1 in 4 to 1 in 3 people in almost all the world is going to be over the age of 65, you start realizing that you're going to have to provide entertainment that's going to meet the requirements those people have.
There's a phenomenon that happens here in Tucson that I will gingerly and carefully discuss, because it's a very positive and a very, to some degree, detrimental thing, and that's the idea of we call them snowbirds. Obviously the weather right now in Tucson is a little bit cold, but it's 46 degrees, which is not even close to what it would be in the north part of Midwest, Minneapolis, whatever, right? So you start to see the, instead of it's kind of a funny statement, you start to see the license plates change. Rather than the color of the leaves change, the color of the license plates change, because you start seeing Minnesota, Alberta, Canada, you start seeing, Michigan and all that. And what's interesting is just the amount of traffic in the roads is significant right now compared to, 3-4 months from
July.
Now.
Yeah. I get it. And as somebody who visits your part of the world pretty frequently around Phoenix and Tucson, if I want to go there for meetings, I'm always amazed. I can stay in a very nice hotel in Phoenix for $80 to $150 in the summer. If I want to go stay in that same hotel in January, it could be $300 or $400, right?
Easily.
And that's just that peak demand. And so we tend to grab a statistic like that, this aging statistic, but what we have to do is think through what does that mean in terms of scenarios. So let's take for another statistic, and that is the drought. The Great Western Drought that's been happening has had significant impact in Salt Lake City, for example. The Great Salt Lake is almost dry and could well go completely dry within the next 2 years. But more significant is Lake Powell, which of course is on the Utah-Arizona border. Lake Powell produces almost all the water for southern Nevada. That means Las Vegas. It produces more than half the water for Los Angeles and the surrounding towns of Los Angeles. And I know it's significant also for Phoenix. I don't know if it's 50 or 60%, but it's very high. And we already have places, some towns, suburbs of Phoenix, where they're shutting off the tap, where the water district is saying, okay, to people in Phoenix with water, we're not going to ship water out to your suburb anymore. And people are having to send tankers out for their small subdevelopments that they've built out there. So, and Lake Powell is 3 years from perhaps hitting what they call dead water or dead zone or dead pool. And that means that the water will not be high enough in the river to go over the spillway. If the water doesn't go over the spillway, it doesn't turn the turbines, and you don't get any electricity. And of course, Lake Powell produces most of the electricity for Las Vegas and any of these towns that we've been talking about. So now we got two trends. You got this trend around the drought, and you got this trend around people wanting to live in Phoenix, the snowbirds, as you talked about. Well, what's going to happen? What's going to happen if the drought persists? And so today we have people getting older, people that have been maybe in their 50s, 60s, and 70s, and start saying, you know what, I could go get a condo in Tucson. It would be wonderful, lovely. I think I'm going to do that. I'm 7 years old. I want to spend my summers in Tucson, or my winters in Tucson, maybe even longer than that. And then but now they can't get any water, or they can't get sufficient water, or there's a shortage. Power's having to be shut down several times a week in order to because there's just not enough power being produced. So what we're getting towards here is saying you can't take that one trend, which is aging, and project off of it and say, okay, that's the future. You have to start to bring multiple trends together. Let me give you another example. Everything you've heard about aging, would you think that Medicare and Social Security are at risk of running out of funds in the next 2 decades?
Absolutely.
You would think that would be true.
Yeah.
Right?
Yeah.
And we hear a lot of politicians have talked about that. Recently, it came up in the State of the Union, and so both the Democrats and the Republicans have been talking about reform for Social Security, for example, is a phrase that comes up. But in reality, if you go pull the numbers and you get what the people at the Congressional Budget Office, which is nonpartisan, and you look at the analytics, there's more to it than that, because the Social Security is like a tax. It's not like that we got all this money sitting in the bank. It's a tax. And so people are paying into it every year and people are taking out of it every year. And so you would say, oh, well, as long as, if the aging population is going to keep pulling more out and not enough people young making money, it's going to be enough going in. So it's going to have a crisis. But what that misses is what's happening in the overall economy, right? And in 2009, when we were first taking a look at this, they projected that by 2051, it would 11% of the total U.S. economy would go for Medicare. 11% just for Medicare was a projection for 2051.
What is it now? Do you know?
Well, yeah, they just reprojected it, and now it's projected to be 4% of the economy. What's the difference? Well, okay, when you're projecting forward, and if you do it with a calculator, you do compounding. Well, they had projected the cost of healthcare to go up at a specific rate per year, and as you got further in the future, the compounding went up. But the reality is that ever since the Affordable Care Act was passed, the increased cost of healthcare has been less. We're still the most expensive healthcare country in the world, in the United States, but the rate of growth of that cost has dropped dramatically since that bill was passed. And now because of that, we're seeing that the healthcare increase year over year is much more like 2 to 4%, right? And at the same time, what we're seeing is that you have to account for the economy is going to grow. So you say, okay, if you had a no-growth economy, sure, then this 4% growth is going to eat us all up. But the economy is growing every year. We did have a significant recession 2 years ago. We may have another recession coming up next year. But in general, the economy grows at 3% per year. 2 to 3% per year. So when you factor in the economy growing at 2 to 3% per year and the fact that healthcare costs they're not going up like they used to, instead of thinking that it's going to be 10, 11% of the Medicare being 10% of the economy, which would be a backbreaker, it's projected to be more like 4. Now here's the third thing. What's regulation going to be? We are the most expensive healthcare country in the world. The way we practice healthcare with the private insurance companies and the way we price drugs and just the whole system.
Yeah, the whole system
is the most expensive in the world, and it doesn't get better results. I mean, there's been dozens of studies about this. Life expectancy is not longer in the United States because of this very expensive healthcare. A few policy changes, like the Affordable Care Act was a policy change by the government. And what happens is you can start to impact that kind of a problem in a very big way. In other words, you don't have to wholesale overhaul Social Security and Medicare. You could literally tweak it a little bit, and you could have significant results. So let me give you an example. In the United States, we have an addiction crisis. I think addiction deaths, drug overdose deaths, now the second most popular form of death. It's a terrible way to phrase it. But yeah, people dying every single day of drug overdose.
Of a particular demographic or of what ages, do you know?
It affects everybody, but the hardest hit demographic are people between the ages of 15 and 35.
Yeah.
Okay. But that demographic is getting older because addiction has started with people in their 20s and they're getting older and they're living with addiction for a longer period of time. Now, in the United States, there's a drug you can take that will stop you from taking methamphetamines. It will stop you from taking the most popular drugs that cause these overdoses. But we don't prescribe it in the United States. If you want to prescribe that drug, the only physicians who can do so have to be specifically trained to deal with drug addiction. So your medical doctor, your patient comes in, the patient says, my brother is a drug addict.
Yeah.
And the drug addict comes in, admits he's a drug addict, and we say, well, here's a drug that could really make a difference in whether or not he will remain a drug addict. That doctor cannot prescribe that drug. He has to send them to a specialist in drug addiction, of which there are very few in the United States. And then those specialists are limited in how many of these drugs they can pass out. It's a policy. It's a federal policy about how we're going to manage drug addiction. France flipped that coin and they said, any physician that wants to prescribe this drug can. And they dropped the number of deaths due to drug addiction by 70% in 6 months. In 6 months, 70% of the death number went down by 70% in 6 months. That's an example of a policy change. So we could have policy changes made in America that could have a big impact on our costs. So, for example, right now, the number one approach of people that are of the lower socioeconomic groups, their number one place to go to the doctor is the emergency room. They don't have a regular doctor, right? They don't go to a regular doctor. And so therefore, when they get sick, they show up in an emergency room. And we know that's the most costly way to meet a doctor. I mean, the emergency rooms are expensive to maintain. They have to deal with all kinds of horrible problems. When somebody shows up and they've just got, a bad pain and they don't know why they got a bad pain, they have to be diagnosed. And they do what you would think of easily could happen over the phone in many instances, or certainly on a Zoom call. You could deal with a lot of this. Instead, it's being handled by the ER. In fact, we've tried at times to put clinics into places like drug dispensaries, right? Like our pharmacies, Walgreens, CVS, some grocery stores have pharmacies in them. And there you could do the same thing. It's much, much lower cost. Well, we've kind of had these ideas. We've done a few tests of it, but people don't do it. The reality is that as we age, and it's harder and harder to see a doctor, and it's more costly to go see a doctor, what's natural? It's natural to assume there will be a policy change. And that policy change will probably say, well, we can start to take care of some of these issues. We've learned in the pandemic, these can be handled with a Zoom call, right? Or a Skype
Yeah, the whole electronic health. I mean, it's definitely a booming economy. It needs to be.
So now you can start saying, okay, well, people are getting older. They're going to need more health care. But rather than going to the doctor on traditional Medicare, we could put in place Medicare policies that would say that when you feel sick, here's who you're going to talk to first. So you get on a Zoom call, you talk to a physician's assistant, you go through the initial diagnostics, and then you try to see if that solves your problem. And maybe the physician's assistant, runs it by a doctor, does some prescription drugs, whatever, ask for some tests, and you're working with a larger pool of people, physicians' assistants, that are less costly than dealing with somebody who's a fully trained medical doctor. So you get more leverage out of the system. So the point here I'm making is that when you start to take forward your scenarios, you could take a demographic statistic and say, oh my gosh, Social Security is going to blow up. And a lot of politicians are saying that today, and it's unlikely. It's actually a very unlikely outcome because if you look at the scenarios, the economy is going to grow. You're going to have lower costs of healthcare. We've seen changes made during the pandemic in terms of how we apply healthcare that could drive the costs down. All those things mean that we're very unlikely to end up with a crisis in Social Security like the politicians are making hay. This is why you need to move beyond one statistic and start to think about some other statistics. Now, we do know we're going to need people to work, right? But the world of work has changed, right? Now we have WFH, work from home.
Yep.
You see it all the time in the newspapers now when I'm reading my online newspapers, WFH, work from home. And so I do a little statistic work on this. We found out that you can even move beyond just looking at statistics. And there was a study done where they actually took 3,000 people in England that worked for 30, I'm trying to remember how many companies now it was. I believe it was about 100 companies. So, and they took 3,000 people and they said, you're going to work 4 days, 32 hours.
Okay.
So you're literally not like, okay, instead of 40 hours on 5 days, you work 40 hours in 4 days? No. They said you're going to work 32 hours is what you're going to work. And you're going to get paid the same amount of money. And they did this study twice. They did it once about 3 years ago, in which they had, I'm trying to remember now the number of people, but it was about 1,000. It was 1,000 people.
Okay.
Now, 30 companies. Now they've just redid the study with 3,000 people across 75 companies. In the companies that went to a 4-day work week, on average, revenue increased by 35% versus the previous year.
That's
Revenues
remarkable.
went up 35%. Yeah, remarkable increase. Now, there are probably some things in here, like some of the dates may overlap with the pandemic. You may have some issues like that to make the data
But even 10% is significant.
Would be incredible. Yeah. Of the 61 companies that were involved in the most recent test, 56 are going to continue with a 4-day work week, and 18 are going to make it absolutely permanent because they had no resignations. Remember when we did a podcast about the Great Resignation?
The Great Resignation, exactly.
Yeah. So people talk about work from home. Now we're talking about people saying, I'm only going to work 32 hours a week. I'm not even going to work 40. I want to get paid the same amount of money, but work fewer hours. And studies have shown that the companies actually did better, performed better, and the employees, the productivity went up sharply, and the resignations went away. 1/3 of the people, 1/3 of those 3,000 people said that they would never go back to working 5 days a week. Like that's massive. Not going to happen. Now that I've adjusted my life, it's what I want. 1/3 said that if they would to go back to 5-day work week, their pay would have to go up between 26 and 50%.
Wow.
So in other words, once they got on a 4-day work week, they weren't going to
Yeah,
give
they
it
didn't
up.
want to, they didn't want to leave that.
No. So now here we got another trend, and this ties into work from home. The workers at Amazon right now are pitching a big fit. Amazon's trying to say, we want you to come back to work 3 days a week.
Right.
And they're saying, why? We just went through 3 years where we were working from home. Why do you want me back in the office? I don't see any need to do that. Disney's got the same problem. There's people are really up in the arms of Iger, the CEO who's returned, saying, "Look, you can bring us back to work. All it's going to do is waste my time. I've got to commute. I'm going to be in the office where I'm going to be people are going to get in my way. I don't want to do it." And Apple's had the same problem. And in fact, at this point in time, the occupancy of office buildings, U.S. occupancy of office buildings, is 50% of what it was pre-pandemic.
50%?
Half today.
That's remarkable.
Yeah. So you start saying to yourself, okay, we've had a long time since we kind of sort of said the pandemic was over. And we've had a long time where we're not wearing masks, we're interacting, we're flying on planes, we're doing all this. And if people wanted to go back to the office, they could have, right? These companies are not saying you can't come back to the office, but what we're seeing is they don't. They don't come back. And they're starting to say, if you make me come back, I'm not going to come back. I'm going to quit. So now let's put that into our trend analysis. Or look into our scenario. We have to start saying, okay, we're going to have a future where there's going to be more retirees, right? Retirees are going to have more demands. But the reality is that the people who are going to be there working, not only are there fewer of them, they're going to demand to work fewer hours. Mm-hmm. They're going to say, I want to work from home and I want to work fewer hours. So what does that mean? We're right back to that mobile asynchronous trend stuff, right? We're starting to say that means people are going to be working from home. They're going to have to be way more productive. So productivity tools start to become absolutely essential. Anything that can help the employee get more done in an hour is going to be very beneficial, whether it's a robot or it's something like artificial intelligence. They also did give you another kind of how you build out these scenarios. Okay. You start digging into it. In 1983, 80% of 18-year-olds had a driver's license. This is 1983, okay? 80% of 18-year-olds, and 46% of 16-year-olds had a driver's license. Now, I'll admit, I came from a rural area. You came from a rural area. You were probably like me. I started driving at 14. When my dad was like, okay, if we're going to go somewhere 10, 15 miles away, he had things to do. So you drive, right? He didn't care if I had a driver's license. That didn't even matter to him.
I grew up in a similar situation driving at 11 or 12,
Yeah. And when we were 16, we got a driver's license, and it was considered, you were independent now. And, most of us, I went out and bought a car when I was 16, had my own car, had my own, insurance policies and everything else. Well, in 2021, only 60% of 18-year-olds had a driver's license, and only 25% of 16-year-olds.
Including my son, by the way.
How old is he?
He's 16, and he's got his learner's permit, but he doesn't have his license, and he has the impetus is not really there. It's just different.
He's not excited. He's not chomping at the bit.
No, and he's got a pickup truck that his grandfather gave him, so it's not a question of he doesn't have a car. I mean, it's there waiting for him.
So what kind of things are in your mind as to why he isn't like you and I wanting to go get that driver's license?
Well, it goes back to what's popular now. I mean, he's 16. He's into gaming. He's he's glued to his phone a lot of the time. And so when they have parties or whatever with his buddies, a lot of it is online. They're streaming. They're playing their games. They've got their headphones on. They're talking to their buddies, one of them across the road or the other them across the town. And it's just the new normal for that age. And this is what I've said in the past. If you want to see what's going to be mega popular in 10 years, look at what the 15 and 16-year-olds are doing.
Yeah. I mean, if we wanted to visit with our friends, male or female, we had to go to their house, right? We'd go to a meetup location. Remember, this more your generation than mine. People used to go to the mall just to meet up with folks, just to share experiences. But you're right. Today, people are actually more connected than you and I were because We had to go somewhere to meet 3 friends to do something. Now they can use social media tools and be simultaneously connected to 50, 60 people. They can be connected as friends. They can be connected to groups. They can be communicating with multiple social media tools at the same time. They're more connected than we were. And that's hard for a lot of people older to understand. They think, well, you're sitting at home alone, you're not connected, and they don't realize, oh, yes, I'm connected. I'm playing my game. I'm interacting.
Right.
And Philip and Janice and Harold are all playing the game with me, and we're talking to each other through the system as we're playing the game. And it's not, it's not a board game where we have to sit at a table. It's now this interactive game we can do on a computer. So what we're getting back to here now is, okay, what are these people going to be like in 10, 15 years? Are they still going to want to drive, or are they not going to want to drive? What do you think is going to happen? And so they did quite a bit of the New York Times did a report on quite a study they did questioning people that didn't get a driver's license and trying to say, well, why didn't you get it? And what you and I just talked about, which is a changing environment, allowing people to interact without having to get physically together, was the number one. But number two was they didn't want the responsibility. They said, look, I don't want to own a car. I don't want to have to take care of a car. I don't want to drive a car, because if I drive a car, I could have an accident. Why would I want to do that when I could take an Uber to visit my friends?
It's
when I actually
world.
want to go somewhere. Yeah. I mean, and it makes sense. My son that moved to Boston, my kids were growing up, they all had cars, they all drove around. But when my son went to Boston, he really deliberated whether he was going to take a car at all, because he said, I don't think I need one at all anymore. He ended up taking a very small car with him to Boston. But he frequently tells me that the car sits in some parking lot to the point where he was constantly having to go, every time he wanted to use it, he had to get somebody to jumpstart it because he couldn't keep the battery up because he was driving it so rarely. But it makes sense. If you're living in a metro area like Boston, he's living in Charlestown, he works in Boston, he's got mass transit and he's got Uber. So if he wants to go somewhere like the grocery store, it's $5. The long-term cost of owning an automobile, oh my gosh, it's what is it you put down to buy the thing? It could be quite a bit of money, right? And then you have to pay for either fuel or or electricity,
insurance,
and if
maintenance,
it's an internal combustion engine car, it's quite a bit of maintenance. You have insurance that you have to cover on the cost, and some of these insurance policies for boys under the age of 21, you could be looking at $400 or $500 a month, sometimes for those insurance policies. So it is, the numbers work pretty good. You don't need to have it. And why take on a responsibility that I don't have to take on? So that shows a very practical way of thinking about the world. More practical than emotional, I would say, right?
Yeah, for sure.
Emotionally, we wanted a driver's license. We wanted to be independent from our parents. We wanted to get out of the house and go do things. This is a very practical sort of like, my parents are following me around anyway. They got software on my phone to know where I am all the time. So I might as well be at home and do my interactions here. So it tells you these people are going to be very practical. And it's very practical people that are engaging with video games. What's going to happen whenever they work? Are they going to go to the office? Are they going to want to go through a traditional career of school and office the way we did? No.
Yeah.
They're going to sit back and say, well, how much training do I need to do something I want to do? And can I get there in 2 years of training, 3? Is 4 years of college the right answer for me? And then they're probably going to go into work and they're going to demand that they work in an environment where it's probably not 40 hours a week, which is kind of amazing because you and I grew up in an environment where we often worked 60 hours a week, right? As technology came along, remember the days with a briefcase when you actually took work home, you read it on the train or whatever, but you pretty much had your evenings and weekends free. Then with the advent of cell phones and all the other technology, including computers, I think we started bleeding that off until we were working 60 hours a week.
I think that my generation, or at least when I started working, I was working from home, Adam, in the year 2000. And I was a very rare, at the time, I was in sales. I was remote. The headquarters was in Austin, Texas. I happened to live at the time also in Tucson. And I had an office. I had a computer. And what I would do is I would, in the morning, get up, get ready, get like I was going to go to the office. And I'd walk from one room to the other and sit on my laptop and on my cell phone, and was able to do that 23 years ago. And so I'm working a lot, but I'm also a lot more effective, a lot more efficient because I'm using tools like my cell phone. I'm connected on social media. I'm connected on different platforms. Email, of course, is prevalent, but I'm a little old school. I like to meet in person. I like to pick up the phone. I'm going to be going on a business trip here for a week, going to France and to meet with somebody in person. I think there's a lot of value to that still. But there's a lot of other people that would be handling this with a Zoom call.
Well, and again, what I think we're trying to impress people is, what does this tell us about our future scenarios? Well, we talked recently about artificial intelligence, and it's doing more. Remember the podcast, you were putting queries into chat GPT.
Yeah.
Right?
Chat GPT.
Yeah. Yep. You were putting the queries in and reading them real time back to this AI tool. Well, AI is going to become more prevalent. It's kind of like there's a lot of people afraid of AI and artificial intelligence. They don't know what it means. They're afraid of the computers taking over the world. Well, you know what? Everybody was afraid of the internet when it started. Yeah. Every new technology that comes along seems to scare people that it's going to take over the world. But the reality is that we need that efficiency, But back again to if I could sit at a computer, then I could talk to an animatron. And I could say, I'm suffering from these symptoms. And that animatron could walk through a diagnostic tool set, an artificial intelligence type tool set like a physician has, to come down to 2 or 3 recommended things I could deal with it. So try these 2 things to see if it improves it. And then there was no human interaction at all. That's where we're headed. We're going to have that level of sophistication. We're going to have that level of efficiency to operate in a world where there's so many people over the age of 65 and so few people around to do the traditional work. And
it's remarkable how fast that happens. A year ago, I was driving in Phoenix and I saw a small robot on the Arizona State University campus delivering food. And it was novel and people were looking at it and it was a big deal. I was on campus at the University of Arizona yesterday and it was swarming. I must have seen about a dozen of those robots cruising around, delivering food. And same thing with ChatGPT. In a matter of a year, it's going to be ubiquitous. And if you're not on the train, you're going to be left behind at the station. So definitely need to look at these scenarios and layer on top all the different trends that are going to be affecting your business. And there's a whole giant sort of vector of growth that if you're not behind it, you're going to be left behind.
So, I think the point here is, I hope for our listeners, was we started with a trend, but then we started looking at multiple trends and we started to develop a scenario of what the world's going to look like in the future. And that's what everybody should be doing because it will affect your business. And what it tells you is you can't depend on labor for the next 20 years. You're going to have to start doing more with robotics, artificial intelligence, and other productivity tools, and count on it. And if they're not there, develop them. You're going to make money if you do. If you can develop these tools, then there's going to be a big market for those tools at the same time. And look for policy changes that you may not have expected, changes in how we manage end of life, hospice care. We're going to see policy changes to reflect the realities of people who are living in the world. And if you're ahead of that curve, your business you'll be successful through 2050. If you're constantly getting battered because you're behind the curve and it's like, oh, what's going to happen next? You obviously one of them is going to kick you out and you won't be able to survive. So scenario planning is absolutely crucial, and it's the most important part of our long range strategic planning. And I hope all of our listeners are making their own walks down these multi trend routes. Yeah. And if they need help, they should call us.
Yeah, and this is exactly the kind of stuff we like to do. We do very well. And so we invite you to email Manny@sparkpartners.com or Adam@sparkpartners.com. If you have any questions on some of the data that we shared today and the source, give us a ring, send us an email. And we're always excited to speak with folks that are looking at really their sights on growing their business. It's not going to happen by accident. You got to put a lot of intent with that. So Adam, final thought before we log off for today?
I hope everybody out there is doing some scenario planning and they practice it every week.
Indeed. All right. We'll talk to you next week, Adam. Cheers.
Thank you.